Good evening. Assalamu alaikum and Eid Mubarak. Heartiest welcome to all professionals at National Indian Life. Today, for about 40 minutes, we will debate on human capital challenges in healthcare. Special reference to Saudi Arabia, the biggest economy of Middle East and Africa region, with over 35 million population and 683 billion USD of gross domestic product, where healthcare expenditure is approximately 4.8% of GDP, which stands approximately 46 billion US dollars. It makes Kingdom of Saudi Arabia and the Middle East the biggest spender, with approximately of 15% of its government expenses going in healthcare. As Saudi Arabia is pushing and aligning itself for Vision 2030 to revolutionize the healthcare sector by inviting private partnership to its GDP from 40% to 65%. The biggest challenge now is with the human capital function, which has barely grown from a personal management to a full-fledged HR function, and to employ happiness or the strategic HR business partner. Mashram LinkedIn Live is part of Global Society of Human Resource, Global Society of HCM, the Emerging Global HR Society. We have been organizing seminars, conferences, HR majlis, mentoring programs, annual awards, and this year we have launched the Mashram Live Wire, wherein we bring to you the global best practices, newer concepts, success stories, brainstorming sessions of industry-specific challenges, legal, labor, compliances issues of countries or of the region. This initiative is part of Global Society of HCM Vision, One World, One Community. Today, to debate with me on this burning topic, or which we say the highly desired topic, the emerging human capital challenges in healthcare and its remedies. Today we have with me Turki Al-Khuraimi, Chartered MCIPD and CPHR. Turki has been the head of HR, and he has been the CHRO and HR director with over 15 years of experience in healthcare sector. May I request Turki Al-Khuraimi, Chartered MCIPD, CPHR, to first give you introduction, and then from there we'll take on for the bigger picture.
Turki. Sure. Thank you, Sandeep, for the kind introduction. Assalamu alaikum wa rahmatullahi wa barakatuh. Kull aam wa antum bi khair. Happy Eid for everybody, and I'm very happy to be here, inshallah, exchanging the knowledge and the information for the professional human resources practitioners. My name is Turki Al-Khuraimi, and I have over 15 years experience in the different fields in human resources management, mostly with the healthcare industry. When I started, that was, I think, if I remember, it was something around 2015, 16. Hopefully that this will be a very fruitful session for us, and that will be a brainstorming session that will benefit everybody here, including myself. Thank you so much. Looking forward.
Thanks, Turki, for this your wonderful and introduction. There are certain facts and numbers which we would like to bring on the table before we go on for a discussion on the human capital challenges in this emerging area of healthcare, which is one of the thrust areas of Vision 2030. The Saudi population, 35 million. GDP, 683 billion US dollars. Total expenditure on healthcare per capita, 2,466 US dollars. Life expectancy, approximately 74 to 76 years. By the way, 60 years for the lesser income group, and for the higher income group, it is 80 years. The total expenditure on healthcare as a percentage of GDP, 4.7%, which is approximately 46 billion US dollars. The current, the total overseas patients, which in 2 years before this figure is approximately $1 billion, where the people have spent, and this is the recorded number. And then we have got a large non-recorded financial numbers are there, which is not recorded as part. Then we have the public sector dominates the healthcare. Then it has got the 79 bed capacity till now. It is taken by the public sector. Now it is learned that the public sector is going to add around 13,875 beds, and this will increase public sector participation to 26,000 beds. The total of 20,000 beds will be added further by the private sector. And the current capacity of the Saudi Arabia, which is approximately 70,000 beds, which is still lesser than the desired numbers, is expected to grow by 119,000 beds by this end of 2020. This is very, very interesting numbers. 36 new hospitals are under commissioning as per the 2019 strategy. And in the next 2 years, it is expected that 18 more hospitals will be commissioned. Now, these are very, very interesting number for us. That means, and we have not gone to the projection now. The projection numbers, projection things are way lucrative than what these numbers are on the table. Now, Turkey, given these numbers, which are very, very interesting numbers, and I see that the Vision 2030 is again going to throw open the huge opportunity in the healthcare sector. So we will be discussing today on context of these numbers, and then we will also share some projections. Based on these numbers, then we will discuss on certain areas. And first, let's go on a broad framework of that, how the existing healthcare structure in KSA looks like, and Vision 2030.
Sure. The current structure of the healthcare services or organization in the kingdom it is very simple to say that it is a service based on the need only. That if there's someone who is in need for a healthcare service, then it means the only thing that they will do, they will be heading to any type of hospital or medical provider. Where in the Vision 2030, that the evolving of healthcare and the improvement of the healthcare sector as one of the main areas to be improved is it is concentrating mostly in giving the chance for the I would say for the investment, for foreign investment, with 100% ownership for their investment in the kingdom. And from there, they will start, the MOH started to offer based on the vision, the privatization of the MOH hospitals and clinics around the kingdom, where it will mean that it is a new start for the healthcare industry, that it is reaching to the customers and in a very high quality. In term also for that also you can add that it is increasing that means it will increase the bed capacity, which is a reflect of increasing of the organization that they will be providing the healthcare service and in our industry. Increasing the bed capacity will be as a result also of the expected increase of the population in the kingdom from the Saudis or other nationalities, and they emphasize more in giving more training, specialized training for the practitioners in areas to be very expert in areas in treatment of the I would say chronic diseases such as the heart diseases or diabetes or the cancers. That was a big concern for the nations and also for the kingdom.
Thank you, Turki. Now, there are certain numbers which I would like to again throw open in terms of the Vision 2030. And these are certain very interesting projections. The projection is that by 2050, the population of Saudi Arabia is going to be 77 million. That's one. Second, and then it says that 70% of this population will be below 40 years. The life expectancy of the country, of the people, will increase from the current structure or current number to 78. That means it's almost reaching the higher income group countries. There is going to be a need of minimum of 20,000 additional beds by 2030. 295 new hospitals are going to get commissioned by 2030. It says that non-communicable disease deaths will account to 68%. That means the kind of a quality of service is going to go phenomenally high as compared to the current structures, right? Now, forget about COVID. No, COVID pandemic and all which is going around right now, which is a global phenomena. We'll just remove that. Then there's going to be a requirement of 13,700 doctors by 2030 alone, which is very interesting. And healthcare will continue to hold the third largest budget spending. Now, here the take is, the Vision 2030 says that let's increase the contribution of private sector into the healthcare as a part of contribution to the GDP from the current structure, which is 40%, to approximately 65%. And then they are pushing a lot of privatization, that means. And we spoke about the numbers before, that the numbers are bad as compared to the public to private sector. There's a phenomenal increase in the private sector bed ratio capacity. And then lastly is very, very interesting is foreign investors. The Vision 30 and a lot of changes in the investment structure says that they're going to be 100% ownership in healthcare investment. Now, how this going to shape the future of healthcare in Saudi Arabia?
This is a very important question, and it is a critical point to be discussing it in like 5 minutes. But let me say it in a very short words, that having all these options that will increase the quality of the service for the hospitals and for the healthcare provider within the kingdom, this will increase the competition between the providers to come up with the best ideas and qualities that matches the Vision 2030. And it will not be an easy. I would say it will be like an easy job for the organization to survive these. Everybody will be surviving, but the idea is to acquire the biggest part of the cake that in the healthcare industry, that if you will be a reliable or trusted service provider. Vision 2030 is open for investments, open for many improvement in the healthcare industry. It gives the chance for them, for these organizations to increase their capacity in terms of the quality, in terms of the services they provide, in terms of the patient they serve, and it gives also a lot of I would say like easy contributions from the government to the organizations who are really in following the vision of the kingdom, that the 2030 vision, and the emerge plan for to match this 2030. It is very hard later on to involve in, to be competing in such industry unless you will have the differentiator in terms of service or specialties.
Now, given this background, this financial and non-financial numbers, the next, the area which we're going to do a little brainstorming is on the healthcare services and customers. Now, the data showed that a lot of people, I'm saying a lot of people, the customers, especially the patient services, is that for the tertiary care and sometimes the secondary care, a lot of Saudi nationals with their families have been visiting the cheaper destinations like the India or in Thailand or in other South Asian countries. And then some specialized treatment, they've been going to Europe or a Turkey or America or a Canada. Now, is this this travel of these customers is due to the fact that the quality of service or cost of service is not meeting the customer expectations? So could you just throw some light on what kind of a healthcare services are emerging in Saudi Arabia, especially the primary healthcare, the secondary healthcare, the tertiary healthcare and quaternary healthcare, and what is and how the customers' expectations are evolving?
Let me start from being from the beginning as a primary care providers. Currently in the kingdom, that the services for being for giving a primary care, it is the most well known in the kingdom, and I would say that the primary care and the secondary care. But when it comes to tertiary and quaternary care, as it is very critical areas, and it needs a highly specialized equipment and expertise to use these equipments. Currently, with the current improvement in the industries that available within with the world and the kingdom, I would not say that going to India or, for example, or Thailand for treatment is will be much expensive. But what we will be aiming to have is the quality that it is available there is here. It will be most of the services that are provided from the other healthcare providers outside. It will be available within the kingdom, as it is the Vision 2030 is showing a great impact on and support for the organizations to do the pharmaceutical industries or the medical equipment industries to be supported by the government, and that will benefit eventually the organization within the kingdom. And if we are comparing the current the current times in terms of the tertiary care and secondary and quaternary care, these are the the new business models are coming with the healthcare in the kingdom. It gives a specific and deep analysis of the treatment for the patients, a very detailed treatment in terms of the service for the patients, and it gives a deep follow-up and update on the conditions of the patient himself or herself. Before, it is only a visit to a doctor and taking your medication, then just go home. If you felt anything that might has a side effects, it means then okay, you can come back to see another doctor, the same doctor, for another medication. Whereas the new healthcare industry, it is coming in a different way for giving the extended care in details for the patient, to make sure that the patient is happy and is served in a very high quality with a very high standard. It matches the standards that it will be shown, or the countries in Far East or Europe or the States or North America has. And I'm very sure one day we will be one of the best providers in the kingdom for the Middle East, also in terms of the healthcare industries and expertise.
Perfect. Turkey, I'll just throw a few numbers again.
Sure.
As they say that number speaks louder than the words. So let's see the numbers more. The international benchmark says that 4 to 6 beds per 1,000 population, which is desired for the people above 65 years of age. We're talking about the long-term care, because since you mentioned about the tertiary care and quaternary care, so these are the set of people where majorly they will need long-term care. And there is already a deficiency of approximately 8,000 to 9,000 beds. And it is expected that by 2035, they're going to be at least, if not less, if not more, at least minimum 40,000 beds will be short for long-term treatment. Now, this number speaks a lot in terms of the future of the newer model of healthcare, which you just mentioned about the tertiary and quaternary care. Yeah. Okay. Now this was pertaining to the healthcare services and customer. Now this brings us to the future of the healthcare. Now these are the numbers which are emerging. This is the new kind of a treatment, which is the gap which could be exploited by the newer investors. And then there is a foreign investment wherein the government has given a freehold, wherein 100% ownership in healthcare is welcome. And then, by the way, the Saudi, the drug authority, they have also been encouraging the manufacturing of the generic drugs in Saudi Arabia. So they are encouraging a lot of investment in terms of, manufacturing of drugs, manufacturing of medical equipment, then 100% ownership. And now there is a gap. Then how do you see now the future of healthcare in KSA?
Well, after this, the vision and what the government is providing for in terms of investment in all type of healthcare industries or part or areas, we can see that it is a very big chance for the industry to be left up to a higher level, especially in terms of the tertiary care and quaternary care as well. I will tell you the one reason, because tertiary care, because I think maybe some of the participants are not aware of what is the exact tertiary care means. Small example of tertiary care is if we have like a coronary artery bypass surgery or renal or hemodialysis surgeries. These are very critical surgeries and very delicate ones. It will need a very highly made equipment for the surgeries, and also it will need expertise who's working with that also equipment and tools. So the vision and the future is to have a specific programs by the MOH and the healthcare provider in the kingdoms to provide a specified training for these in these areas, to be ready and to be able to close the gap in terms of the service, and which will reflect also in increasing the patient satisfaction and reliability of the patient on the healthcare providers in the kingdom. Once we can see that we have some organization now in the kingdom that they are turning from being a primary and secondary care to be a tertiary care organization mostly, because with the coming years we can see that this concept is evolving more within the Middle East and also within the Kingdom of Saudi Arabia.
Okay, tell us about, you have also worked in some very innovative healthcare, you can say, I can say the healthcare companies, like you were in my clinic, and this was a typically outpatient, right? Or was it a primary care? Primary care basically, right?
Exactly,
so it is not typically a full healthcare system like Dr. Suleiman Habib. They have got their outpatient department, and they have got a day care surgery, and they've got a specialist. So they are specializing in, say, tertiary care, only on certain areas.
Exactly.
But not all the hospitals are equipped, or their strategy is to take on the entire facility of entire type of the healthcare services.
Exactly.
So
yes,
yeah, go ahead.
I will tell this also in a very simple word, that the current services that is provided within the most of the organization, as you said, it is mostly a primary care and secondary, and the tertiary care. You can find some organization that they have this as a differentiator for their for within their specialties only, not like a general organization which is specialized in tertiary care in general. But most of the organization now, they are moving to the extended care and how to serve the patient, and making sure that it serve it reach to the patient expectations, and also to add the value of the healthcare industry, sorry, of the healthcare of the patient, of the human, and make sure and trust the organization that the patient will come back again to the organization to be served. But with it, and I would say also in another word, that tertiary care concept as a business model in the kingdom, it is a totally new concept that evolving within the country, and it's really needed, as it is a very specialized area and business model for the healthcare industry.
So now this takes us to the very interesting part of the discussion, which is human resource function. We have seen a huge opportunity. We have seen new dynamics emerging. We have seen opportunities which the Vision 2030 is throwing open to the private sector investors. People, investment companies are bringing their healthcare initiatives from UK, Europe, America, Canada to Saudi Arabia. Now, with this comes another big issue: the quality of service and the quality of best practices that comes in. Now, in the existing structure of HR, and you know that if you'll believe with me that we have barely come out from the personal management and international recruitment function in healthcare structures. We have got a good practices in FMCG. We have got some good practices in retail sector, right? Healthcare looks still a very, very unorganized sector in Saudi Arabia.
Yeah.
Not saying that the HR professionals in healthcare are, a seasoned professionals and they're not delivering, the kind of good HR practices. But I'm saying there's a huge gap. There's a huge gap. Have and have nots. The gap is very huge. We are talking about these big giants bringing this best practices. And then we have got that existing structures, companies like Dr. Suleiman Habib, Dalla Hospital, IMC Hospital, Almana Hospital, you call it My Clinic, then you call it Al Dasari Hospital, right? And now these hospitals, majority of the HR function, they have barely come out from that personal management and GRO, PRO style of structure. Now, there's going to be a huge competition in terms of the excellent and exceptional HR practices which this mega company or the huge multinational companies are going to bring with them. And there's going to be a huge practice gap between what is the HR practices that is currently available in Saudi Arabia and what is going to come in next 10 to 20 years time.
Yeah.
Now, given the fact that, just tell us how the HR is evolving in Saudi Arabia.
Very good. Let me go back
in healthcare.
Yes, I will go back like 10 years ago to start from the HR department. If we ask anybody in any company, what is the HR for you? What does HR do for you? And what is the meaning of the human resources in your point of view? You will find only the answer of time management and disciplinary departments, which is this is not the fact of the HR or through HR. Human resources is way different than that. It is, if we will define the HR accurately, you can say it is a business partner, a strong business partner for the industry, for the success of any industry. If you will start about with planning how to acquire the good candidates, how to come through the test of the psychometrics or background test that it will ensure this is the right candidate for you, how you will involve the employees with your decision, how you will improve the environment, how the engagement of the employees in the decision making of the management for the HR, how you will hear the employees to make the improvement to the area, what are the best practices for the department, for the HR, that you can implement within your department that will increase the loyalty of your employee of the employees, and what are the things that you need to give to the employees in terms of the services. Before, I would say that it was manual service. One request might take 2 to 3 days, and for a lazy HR practitioner, it might reach to 1 week. But currently, with the technological, I would say, era in these times, in these years, the service the longest service in terms for the HR department, it will not reach more than 3 hours if it's like a very complicated request. But mostly it is a simple clicks that will give you the results for the employees and saving the time and money for the organization, for the employees. HR department, in terms of the for the new HR, if you will speak about what is how the HR will become a business partner for any health organization. Higher, mostly it's about the attraction and retention, how you will attract the candidates, how you will use your employees as a branding tool for the organization through the services, through the culture that you are and the environment you are creating to the employees. What are the things that you are setting in terms of the policies and procedures, how you are using the analytics skills that you have as an HR expert to come up with the best ideas, with the best practices, even if you will create your own ideas to become one of the best practices in the area, in the industry. So it is an open ocean that everybody can go through it, but surviving it, you will need to have a very sharp and open mindset that you can accept the change, you can enforce the change in a smart way, I will say, because you don't want to reach to a point that your candidates or your qualified candidates will be a burnout due to because you are exceeding their human limits of the service that we want. Eventually, it will reach to a point that you will find your qualified or best qualified candidates or practitioners, either doctors or nurses or allied health, will be moving out. Even it might go for a lower standard or a lower organization within your lower than your standards, just because you are not giving them the right environment, you're not giving them the right appreciation in terms of the what are the return for the employees in terms of the I would say a clear policy and procedures for the employees that they can know understand it, a fair environment in terms of treatment with the employees. There's no closer employee than there's no employees that alike or dislike these employees. So HR, I will say it's a key factor that will balance the relationship between the employee and the organization, especially in the healthcare, because we see a lot of incidents that once the HR department is not that strong and trusted, things will start losing down, and it will create a lot of waste of time and cost financially to the organization and in terms of people as well.
So that now brings us to the most important part of the discussion. Before we go into that, just to inform you, the viewers, that this live wire of Meshram is powered by Medic Talent, the global leader in medical healthcare talent advisory. They are the one who are the expert in headhunting of the C-suite, the top management, the medical expert all across the globe, bulk nursing or the medical technicians, and they also manage the healthcare experts portfolios. Now, coming back to the today's the last point, Turki, recommended future-focused human capital practice. Now, there are few things which I would like you to focus on. Is this is a healthcare. This is not a typically construction sector or retail sector or hospitality sector. There are a lot of compliances here. A lot of compliances, in terms of, if I say, is in terms of that licensing of the hospitals, then licensing of the individuals, doctors, nurses, okay, then licensing of the specific practices. Now, in this, there are a lot of challenges. Earlier, it used to be a very long procedure even to get a nurse's license from the MOH or the doctor's license from MOH, or to get the approval from the MOH for certain very, very specific labs licenses or specific clinics license. Now, how the thing is spanning out now? You got a Vision 2030, you got a, investment opportunity for the private sectors, and then you have this huge gap. There's a huge opportunity. And the organization would like to exploit, not in terms of exploiting the exploit, but they would like to use this opportunity to put their investment in the right place. But before they would like to put their investment in the right place, they would like to understand that what all are the legal implications are there, compliance issues, the MOH licensing part. Can you just throw a light on how things are spanning out now?
Sure. I will go back also to the past and the future. For once you are starting to license an organization, everything was done. I will talk. It was maybe around 7 to 10 years back ago. Everything that was done manually through paperwork, and this is a process that it will take more than I would say more than 3 months for the final approval to become, or I will say to the initial approval, that you can start processing your buildings and licensing, and to process your other related paperwork with the other government entities. Comparing that to the current days, and we are sure that it will be also improved through the coming years, that currently we are using the technologies that the MOH and the other government entities they are utilizing also. So as requesting for the license for a hospital, currently it will not take more than 3 to 4 days if you have all your paperwork ready with you and everything required from the MOH and other related entities, business government entities are available with you. Then you will start processing your visas for your doctors and nurses. You will be receiving an amount of a specific number of visas as a support from the government. Then, based on the nationalization or say Saudization rate with the business, your visas, I would say your visas quotation will be increasing based on your area within the Nitaqat, we call it. If you are in high green or medium green or platinum, these are all indication for the Saudization level. It was implemented before, but now it has a bigger impact as the government also is supporting, almost reaching to a 50% of their basically of their salaries of the employees for a complete 1 year. Then if you will start with your visas, processing for the nurses, for example, to receive the approval from the MOH, then going to the Ministry of Human Resources, as was called the Ministry of Labor Office. This will take approximately a 5 to 7 months process before. Currently, it got very shortened based on your area, also your location, the Nitaqat or Saudization rate. It might reach to 1 day that you can request and receive the visas immediately, and you can start processing the hiring process for the candidates.
Wow.
These are what is the thing that makes the change point for this HR professional is the knowledge. Because if you have an HR practitioner who's open-minded, understanding what is going on, the new things and new practices of human resources by the government, this will have a great impact a positive great impact actually on the organization, because it will make the process of the healthcare organization or the hospital much easier, and it will not be painful for the organization to waste more time, more money just waiting for a doctor or a nurse to be arrived from outside the kingdom. Things are changing. We are believing that even with the Nitaqat, with the new Ministry of Human Resources, that they are imposing more new ideas about the nationalization and Saudization that will support also the investments of the healthcare and other industries. But more, if we are talking about the healthcare, there is a specific and a special care from the government about healthcare industry and what are the potentials that to be improved and given to the other to the investment to investors to invest in this area within the kingdom. It is a very I would say simple process. At the same time, it is very delicate. You will need someone who has the knowledge and experience to pass with these areas.
Now, we have some questions coming up. There's one gentleman, Chris. He says that COVID-19 pandemic has created a disruption in healthcare sector. So now this has brought healthcare workers to the forefront to the world's attention. And now there's a huge opportunity in the healthcare sector to use this opportunity to expand or as a part of the goodwill gesture and as a part of the community service and as a part of the commercial interest. So how this COVID-19 has little bit changed the way the business has been done in the healthcare sector?
Well, I will say that crisis give you the chance to know more about your organization and people. It will shows the real personality of your employees and the maturity of your organization. What, for example, what happened in our organization now that we are due to this COVID-19 pandemic, we faced a lot of people that our employees they were little bit and also around us around the hospital who's living around the hospital who were a little bit frightened about what might be the impact on them. They are getting a little bit scared and they are little bit worried about their health as well. What we have done is we start going to them, we start reaching them to educate them about the COVID symptoms, to give them all the required, I would say, tools or like the mask and the gloves and how to use it and how to utilize it, and what are the symptoms of the COVID-19 and how to treat with that, and what are the things that to be done if you have, if these symptoms are shown to you, and it is like an education to the employees and to the community around the hospital.
The next question, Turki, it is from Hisham Al-Shahri. He's saying, now there are a lot of huge opportunity in the healthcare sector.
Yeah.
Do you see a change in Saudi nationals picking up medical sector education more, or is it changing, or is it in the same, or will it be expat driven only?
Does he mean that these the Saudi nationals are going for the specialties of medical?
Yes, medical specialty. It could be for the pharmacists, it could be for the nursing, it could be nurses, or it could be a physiotherapist, it could be the doctors.
Yeah,
is it changing the whole scenario?
Exactly. I will tell you one thing. It will change because there's a lot of things that happen that we have some for our also in our organization. We are facing some very high qualified practitioners and nurses and also pharmacists. They are stuck outside of the kingdom and they couldn't come back to the kingdom due to this COVID-19. So the immediate action that we start taking care of, that we start reaching out to the people from these colleges and universities to acquire these people who's once they graduate and to have them working with our organization, and we set a specific training plan that it will be reaching their expectations, which will increase their knowledge, their experience, and we're giving them the practical experience more than the theoretical experience, because what we are facing now, it's something that comes up in an urgent phase, and we need these candidates or these people or these team members to be ready to face with us this pandemic, and to have the maturity enough how to deal with the patient or with the employees or with these any circumstance that might be faced in their daily life. So we start acquiring these people from these colleges, and the results till now during the last 2 to 3 months, it shows a great value to the organization, especially in terms of the Saudization rate that helped the organization. It gave the trust from the organization's practitioners to be dealing with Saudis, and they changed the mindset toward the Saudi practitioners, and so whether they are GPs or doctors or nurses or technicians in pharmacy or for the lab and other areas.
Brilliant. Now, something is coming to my mind, in the future-focused human capital. So, do you visualize that HR of healthcare is going to be the real business partner, and they can create and drive a culture, and they can drive the business of healthcare? Or will it always remain the cost center kind of a thing? Is the perception changing? Or the owners or the business owners are going to still use healthcare as profit maximization business, and for them the HR will always remain a support function or a cost function?
Yeah, let me explain it in another way, or answer this point in another way. To change a mindset of a people or of an owner or of a business employees, you need to show that you are accountable and reliable as a department, not from a personal point of view. If you show the accountability and you show that the reliability that you have as an HR department, you will reach to a point that you are the business partner in every decision making with the either management or board of directors, or even a trusted counselor for the employees.
Yes, we would like to see HR on the board of healthcare. We would like to see in times to come HR as the advisor to the CEO, HR as the advisor to the CFO. And I think so. In this, you mentioned about the analytics. The analytics can play a huge game changer here. Can you just throw us some light on how the analytics can change the way HR is functioning and how HR can drive the business?
Yes, exactly. I will give a very simple example about the usage of the analytics, because if we go in details, it will be a little bit longer. But let us take a look at for example, the attrition rate or the turnover rate. If we could analyze this turnover rate with the outcome of like for example, the interviews with the employees who's leaving during the exit interviews, and you're analyzing the data and the numbers in terms of the cost and the future perspectives, you will find that you will have an added value for the organization and for the HR as an HR professional. You will find also in yourself a change in your mindset, the way you think about the HR department, the way you are marketing the human resources to the employees. Once you speak about numbers will never lie. Once you have the accurate numbers and you do the analytics on terms of what drives the people are, for example, leaving the organization in terms of analytics and numbers, you will find a great value that you are added to the organization, and it will eventually for sure reflect on the reduction of the turnover or retention rate of the employees. Therefore,
how about Turkey? Sorry to interject. How about the analytics of the business, the sales, the quality of service, the customer reviews, the customer feedback?
Yes.
Yes.
These are very important to have for sure. As an HR director and the decision making, you have to be strong in these parts, because if you are a strategic business partner as an HR area, and you are the strategic partner with the management, and you have a reliable data that's giving to the management or to the board of directors or to the CEO, these are the numbers that will be more persuasive for the management to follow your ideas or to come up with the decision. Because once you have this skill of analyzing the sales capacity, the turnover, the return on investment, what are the economical and the other impacts that from outside that might impact the business, how to avoid them, what are the plans that to be avoided, in how to increase the numbers of employees, when to increase the numbers, and where to have a concentrate in terms of the service to be provided to the employees. In terms, I will say, like for example, some hospitals are in demand for nurses, but it doesn't mean that if they are in demand, they have to concentrate more on nurses. There might be, based on the analytics that you will be doing for the future, you might change the game that for the organization to concentrate in another area that need to be improved from now, because it will be implemented in the future. This is one of the paths for the human resources to provide to the management and the board of directors to be a trusted business partner for them, and to give them the right numbers, the facts, so they can they'll rely on that in their process and in their decision making.
Brilliant. With this, I think so. We have come to the end of Live Wire. We have got precisely 2 minutes, and we have a couple of Eid Mubarak coming up from Muhammad Maktal. Then Ihab has joined us, and Muhammad Faisal Ansari has joined us. So before we conclude for today's Live Wire, I would like to thank Turki Al-Khuraimi, Chartered MCIPD, CPHR, for your extremely valuable comments. Indeed, the healthcare area or healthcare sector is emerging as I would say one of the largest or the biggest areas where there's going to be a revolution in terms of private sector or private sector investment, or private and public sector partnership also, PP partnership also.
That's right.
Anything you would like to conclude, Turki, with a few words?
For all the people in the HR industry, I will be a little bit racist. Sorry for that, but I will say that it is good chance for us now, in general, to concentrate on our development. If we will reach to a point that we want to be professional in human resources, we have to concentrate on our personal development plans. That will empower us as the HR professional for any organization that we work for. But there's a lot of a lot of certifications in the world that it might be an added value for them, for the HR professionals. You have the CIPD or the CPHR, the SHRM Association. A lot of these are an added value for you, but if you have utilized them in the right way, not only it's about a title to be received, it is a responsibility that you have to undertake to improve the HR in your area. I wish I have been a lightist for you guys, and I appreciate your time. Thank you so much for that, and looking forward to hear the good news, inshallah, from everybody.
Thank you so much, Turki Al-Khuraimi, Chartered MCIPD, CPHR. It was extremely great to have you at Meshram Live Wire, and we are grateful that I'm sure that other people will take a lot from this a small little discussion we had today. And to all, again, Eid Mubarak. We had last before Eid, and we are having post Eid. So Eid Mubarak to you all, and hope you stay safe and be safe from this pandemic which is going around. Thank you so much. Assalamu alaikum. Ma salama.
Thank you so much.